The main thing at the moment is to ensure that there's adequate supply of the vaccine going through to Aboriginal health services and other places where Aboriginal and Torres Strait Islander people are accessing healthcare. We've seen that the vaccination rates up to now have been lower than that of non-Indigenous Australians, and that's mainly been due to the supply. As we've been getting more Pfizer into our Aboriginal health services, we're seeing coverage rate picks up, so we need to support those efforts wherever it's happening.
Yeah, we heard from the Health Minister, Greg Hunt, yesterday. He said about 16% of the wider population has been fully vaccinated. Only 22% of Indigenous people in remote Australia have their first dose. When you say supply, do you mean the doses themselves, the infrastructure, the storage, the people? What do you mean?
Yeah, look, it's a few things. The first is about doses and getting the doses there, and then we need the people to deliver the doses into those people's arms. So we're getting the first part right now, and we're seeing in a number of communities that we're getting a number of doses out into remote Australia, but we're having trouble with workforce, and we need to work on solutions to, get people vaccinated as quickly as possible.
So do the doses come from the federal government or through the state?
It's a mix, okay? So the dose is coming directly to my Aboriginal health services from the Commonwealth Government, but we've seen partnerships in other states and territories where the jurisdiction has been giving their doses to Aboriginal health services and even supporting them with the rollout. And in other places, we've had the Royal Flying Doctor Service supplying those doses. So, it's not about, this state or Commonwealth. It's just about everyone working together to ensure that remote communities and Aboriginal and Torres Strait Islander people in general.
What would happen if one was to happen in those kind of communities? You've got ones that are hundreds of kilometres from tertiary hospitals.
Yeah, look, wherever it happens, there's going to be a difficulty with increased spread because, unfortunately, we continue to have too many people living in crowded housing. And also just a high number of people having severe disease because we have really high number of people with chronic conditions like diabetes and kidney disease. And that's the people that are most worst affected through COVID-19. So, yeah, we just don't have the infrastructure in these remote places to deal with severe COVID-19. So we'd be seeing a lot of evacuations and a lot of people becoming unwell if it was to get in there.
And what's the age profile of some of the communities that you've been looking at? Are they particularly young and therefore means Pfizer is the vaccine that you need, and obviously that's the one that's in short supply?
Yeah, that's right. So if we look around the country, around 90% of the Aboriginal and Torres Strait Islander population is under the age of 60, where Pfizer is the preferred dose. So while we've had plenty of AstraZeneca in our clinic, we haven't been able to give it to many of our patients because they're mostly under 60. In Yarrabah, the community's average age is 23. So we're looking at a very young population and the population for whom predominantly we need Pfizer. What
about AstraZeneca? Has there been interest in AstraZeneca among the community?
Yeah, definitely. And if we look at the over 60
age group, I should just specify, sorry.
What was that, sorry?
Sorry, in that under 60 age group, I just wanted to qualify that. Has there been interest in taking it, even though, there's this, you need the GP informed consent, etc.?
Yeah, look, there has been some people taking it up since the ATAGI advice change. But importantly, in the over 60 age group, we have quite high coverage. So about 60 to 70% of Aboriginal and Torres Strait Islander people over the age of 60 have received at least one dose, and that's predominantly been AstraZeneca. So there's been good uptake amongst that group and some people taking it in the younger age group.